Thrombus obstruction following the rupture of a high-risk plaque in the coronary arteries is a primary causative factor in the development of a myocardial infarction. Platelets play an essential role in this process by adhering to exposed collagen in the ruptured plaque. Primary stimuli such as collagen activate a cellular signaling cascade in platelets, which results in the release of ADP. ADP mediates its effect by binding to the P2Y12 receptor on platelets, creating a key amplification loop of platelet activation. This contributes to the recruitment of additional platelets, which increases the size and stability of the thrombus. Despite the complexity and number of platelet activators involved, ADP-induced P2Y12 receptor activation holds a central role. This has made it a proven therapeutic target to help reduce thrombotic events. Ticagrelor is an oral antiplatelet agent which acts as an antagonist of the P2Y12 ADP receptor. Unlike the thienopyridine antagonists of P2Y12, ticagrelor is direct-acting, so it does not have to be metabolized within the liver to work. This means that it's active as soon as it's absorbed. It also has a 24-hour systemic exposure when dosed twice daily, whereas the active metabolites of the thienopyridines are not detectable after 4 hours. Ticagrelor binds reversibly to the P2Y12 receptor, in contrast to the irreversible binding of the active metabolites of the thienopyridines. Ticagrelor provides a more rapid, greater and more consistent antiplatelet effect compared with the thienopyridine clopidogrel. This interaction blocks ADP-induced platelet activation and the resultant aggregation, thereby limiting thrombus growth. ADP and ATP are released at sites of tissue damage and ischemia. They are rapidly degraded to form adenosine. However, the half-life of adenosine within the circulation is just a few seconds, due to its rapid uptake by adenosine transporters, including equilibrative nucleoside transporter 1 or ENT1. In addition to the P2Y12 receptor, ticagrelor also inhibits ENT1, which increases local extracellular levels of adenosine by inhibiting its cellular uptake. Ticagrelor has been shown to augment adenosine-induced effects such as coronary blood flow increases in healthy volunteers and ACS patients, headache, the inhibition of platelet function, and dyspnea. However, a link between the observed increases in adenosine and clinical outcomes has not been clearly elucidated. Ticagrelor is a direct-acting, reversibly binding antagonist of P2Y12. With 24-hour systemic exposure when dosed twice daily. It also inhibits the adenosine transporter ENT1. Ticagrelor demonstrates efficacy over clopidogrel and is licensed and endorsed in several guidelines for both PCI and medically managed ACS patients.